Hi everyone, Dr. Nemechek here. I'm going to give you a little case report about somebody recovering from POTS, chronic fatigue syndrome, and then getting whacked by COVID too. So this is a young woman who is pretty healthy, high school, college, no real problems, no ADD, generally felt pretty good. Was an accountant, became a formal CPA, worked for a pretty large accounting firm, was doing pretty good until about 26. She suddenly had this sudden onset of fatigue, brain fog, and nausea, and headaches. She went around, talked to a bunch of people. She gets diagnosed with POTS. Now, in retrospect, in talking to her, that sudden onset, she probably also had chronic fatigue syndrome or myalgic encephalitis, which can be triggered often by just a seemingly mild virus or something that a lot of people don't even remember. But nonetheless, so she's got POTS, brain fog, fatigue, and then gastroparesis was causing her nausea, meaning the stomach wasn't emptying. So she had this neurological problem there. She was also having trouble with temperature regulation. She had to keep her bedroom almost at 60 degrees just to feel comfortable. She just could not handle heat at all. And so we started on the basic protocol. VNS for 2 hours a day, fish oil, olive oil, and then because of the severity of her symptoms, I had chosen to use continuous rifaximin for, I was anticipating maybe 4 or 6 months. And then we would shift her over to intermittent or something like that. And she starts doing a lot better. Within a couple months, her headaches, which were almost daily, are reduced to just a couple days a week. She was saying she thought her brain fog and cognition, fatigue were better. It's not nearly as dramatic as the headaches had already improved, but she could tell on the days when she didn't have a headache, the brain fog was a little better. And interestingly, most of all the symptoms improved a lot when she would lay flat. And what that implies is that she's having trouble generating blood pressure, the proper pressure in her brain, and because of that, you don't get the proper diffusion of oxygen into the neurons. And so when you eliminate gravity by laying flat, things work better, and you can alleviate that. But obviously, you can't live a life laying flat all the time. So we keep going, same thing, and a few more months, brain fog's getting substantially better, fatigue is starting to get better. She's even occasionally having a good day, but she's having this post-exertional fatigue, which is common in chronic fatigue syndrome, where people often say, well, if I have a good day, I go do stuff, but boy, I pay for it the next day, okay? And so we don't know exactly why that happens, but it's pretty typical of ME/CFS. And so continue to do well, keep going. Now we're at about 5 months, 6 months at this point, and then boom, gets COVID. And it's hard to avoid it, And so she gets a lot worse. And in the weeks following that, it doesn't seem like rifaximin's working as well. Now, there isn't drug resistance to rifaximin, that long-term drug resistance. That's not known to exist. And so I thought, well, maybe we have a different bacteria up there. So I added some inulin twice a day and a quarter teaspoon twice a day. That seemed to help some. And then, but still it was kind of off. And then, as I've talked about in my other videos, COVID can cause this different form of leaky gut, most likely due to how it triggers a deficient state, a deficiency of glutamine, the amino acid glutamine. So I added glutamine into her case for good measure at a level tablespoon twice a day, powdered glutamine. And boom, that was it. That was the magic. And she then, in the next few more months, dramatically improves. She said most days she's normal. Most days, if she really pushes it, she's not having any post exertional fatigue the following day. She was starting to pick up some part-time work as an accountant again, trying to just get her legs under her, see what she's able to do. And we then, first thing we did was we stopped the glutamine, and she did well. She didn't have any signs of relapse. And the glutamine deficiency tends to be a short-lived phenomenon. I keep people, if you add the glutamine, it really helps. I keep them on it for maybe 3 to 4 months. The inflammation will come down even further, and now your own internal ability to produce glutamine tends to be enough to supply your needs. You don't need to take that continually. And as of this recording, she's now on intermittent rifaximin and inulin, and she has certain intestinal symptoms and anxiety. If those things spike up, she's going to take both the inulin and the rifaximin twice a day for just 10 days as a way to kind of just stop that. She's staying on the fish oil and olive oil, and as of our last conversation, she was choosing to stay on the VNS. She thinks it really helps cognition. So anyhow, very typical case, outlining, rifaximin needing continuous when people are pretty sick, and sometimes if you get some interruptive process like COVID, I can combine it with another agent like inulin is my preferred prebiotic. And then if COVID is like maybe part of the mix and causing the secondary leaky gut, I just throw the glutamine in there. It'd be nice if we could go in and test things and say, we got this, we got that, we got this. That testing is not available to help us narrow it down. So you kind of have to just sometimes treat a couple things at one time. And then you just, if they're starting to improve after that, then you've made some good guesses and you just work your way out of the problem that way. So other than that, everybody have a great day. And remember, POTS is reversible.